Hi, my name is Brooke Maurer, and I am going to discuss the impact of higher nursing education on quality care. There are 3 learning objectives of the presentation. By the end of the presentation, the learner will be able to explain why higher education is a relevant issue in nursing today. Also, the learner will be able to describe how higher education impacts the nursing practice, healthcare, and society. And lastly, the learner will be able to describe the projected standards of nursing education for the future. The purpose of this presentation is to review the evidence related to whether higher education leads to improved quality outcomes. In 2010, the Institute of Medicine released a report called The Future of Nursing: Leading Change, Advancing Health. This campaign for action calls for 80% of the nursing workforce to obtain a bachelor's degree by 2020. But what is the significance of this trend in nursing? After a thorough review of evidence, some studies prove that better outcomes are linked to the care that is provided by nurses with higher education. Results from the studies are listed below and include a 5% lower mortality rate, lessened failure to rescue by 6%, a reduction of 2 deaths per 1,000 patients, and fewer deaths related to congestive heart failure, decubitus ulcers, and post-operative pulmonary embolism and deep vein thrombosis. There is a lack of consistency in the findings because other factors known for affecting nursing-sensitive patient outcomes like staffing have been found to skew evidence. The truth is that nursing education impacts every member of the nursing profession. Highly educated nurses are needed to meet the progressively intricate demands of the healthcare system. The healthcare system is rapidly changing due to legislative reforms, the increasingly complex needs of the population, the demands of quality care delivery, and the advances in evidence-based practice. This, in turn, advances the scope of nursing, calling each nurse to become increasingly competent in a multitude of other disciplines, such as leadership, management, research, and quality improvement. Higher education empowers the nurse to impact practice guidelines, to meet these needs, and to raise the standards. Nurses must engage in lifelong learning because healthcare is ever-changing. The Bureau of Labor and Statistics projects a nursing shortage of 1 million registered nurses by the year of 2022, with 1/3 of the nursing population to reach retirement in the next 10 to 15 years. This means that there will be an influx of new nurses, which places a significant amount of stress on nursing education programs. Entry level into nursing practice is projected to shift away from diploma programs and associate degree programs because healthcare institutions prefer nurses who are bachelor's prepared. Nurses who are mandated to obtain a bachelor's degree are incentivized through tuition reimbursement, salary increases, and scholarships, but in order to reach this goal with success, academic and employment institutions must remain supportive and flexible to minimize burnout, compassion fatigue, and work-life balance stress. Higher education impacts healthcare because it paves the way for improved, cutting-edge, high-quality delivery of care. Nursing represents the largest segment of the U.S. healthcare workforce. What would healthcare look like without us? What would healthcare look like if nurses obtained higher levels of clinical knowledge and expertise? We should be empowered to grow and shape our beautiful profession by educating ourselves so that way we may reach our fullest potential. Once we do that, we empower our patients and colleagues to do the same. Nurses work alongside other healthcare professionals who practice with entry-level master's degrees. we have an interdisciplinary responsibility to uphold excuse me, the value of what nursing can bring to patients' plan of care. Higher education can transform our practice, thereby transforming healthcare. After all, our thoughts, assessments, and clinical expertise can be crucial in care planning because we spend the most time with our patients. Nurses can make a special impact because we reach individuals across the entire healthcare spectrum, whether that may be in hospitals, homes, schools, community, and public health centers, ambulatory settings, or long-term care facilities. Improving our knowledge can broaden our vision and improve how care is delivered. Higher education also has a unique impact on society. Nurses with higher education can promote the awareness of healthy lifestyle practices for those individuals in their communities. Nurses significantly impact society by creating a culture of wellness through education, outreach, and through resource coordination. Nurses can instill responsibility in their patients to take charge of their own health outcomes while providing support and follow-up. Because nurses are obtaining higher degrees and returning to school, they become more knowledgeable in the realms of management, leadership, research, and collaboration. And patient care becomes more holistic and individualized. Nurses can eliminate gaps in care, shape societal norms, and impact a culture change through education. In conclusion, higher education is relevant in nursing today because many healthcare institutions are mandating nurses to obtain a bachelor's degree by 2020. Since it is 2018, hundreds of nurses are returning to school to meet this goal set forth by the Institute of Medicine. While nurses question whether having a BSN will make them a better nurse, there is sufficient evidence to support that higher education makes a positive impact on quality outcomes and cost savings from adverse outcomes. Furthermore, higher education for the nurse promotes teamwork, job satisfaction, retention, and a sense of accomplishment. Nurses are a force, and being knowledgeable in our art and science can transform healthcare.